So 3 months and 10 days ago, I had gastric bypass Roux-en-Y surgery, and this is my 3-month update, although I'm a little late. I've been wanting to do this for a while, but just get busy or too tired and then don't do it, or get interrupted by children. So my highest weight was 235, and this morning I was 177, so I'm 58 pounds down from my highest weight. On surgery, I was 220 the day of surgery, and 177, so now that's 43 pounds that I've lost since the day of surgery in 3 months and 10 days, so that's pretty good. I'm pretty happy with that. I had a stall that lasted about 2.5 to 3 weeks where I was 179 and just kind of couldn't get past that, so really happy today that I was 177. Pretty much can eat whatever I want now, within reason. I try to be super careful about the sugar because that can make me really sick. Try to have like under 10 grams. Sometimes go up to 15 grams and I'm okay, but anything past that, it'll make you sick, or at least it makes me sick. I don't throw up or anything like that, but I just feel kind of miserable. So yeah, I try to be careful of my sugar. I don't eat a lot of bread. I have a little bit. I can have some crackers with some protein, but I pretty much avoid mostly bread because it just fills you up and then you don't have room for your protein. And I always do the protein first. So I'm pretty regimented about making sure I always get my protein. Have eggs in the morning. Pretty much every morning I have eggs and cheese for breakfast. Occasionally I'll have cereal, but most of the time it's just eggs. That's what I do. And then lunch is usually some kind of meat, chicken or turkey or ham or whatever. Anyway, protein, and then dinner again, protein. So I'm trying to get into the routine of exercise now. Started walking. Tonight I did rowing, but I'm not on a real schedule with that. It just depends on my energy level, but I think that'll help me avoid maybe some of the stalling that I've been doing. But I know it's normal to stall because you're losing weight so fast and your body's just wanting to hang on to it. Plus I'm not getting a lot of calories, so then your body just wants to hang on to everything. But you know, I've lost quite a bit in 3 months, so I went shopping about a size 10 jeans the other day. That was awesome because it used to be 16, 18. Shirts are size large instead of 2XL. So yeah, it's good. Feeling a lot better. For a good while I was dry heaving every single night, or a lot of 3 nights a week. Didn't seem to matter. I could eat it during the day, it'd be fine. If I ate it at night, I would dry heave. So I don't know what was causing that, but it's gone now. So I'm really happy about that. Working still to get my water intake. That's depends on the day. It's a struggle for me. But yeah, overall it's going a lot better. I feel like 3 months is so much better than the first 2. The first 2 were really hard. It's really hard coming off the sugar. It was really hard not to be able to self-medicate with food, which is what I did before. So yeah, that was just hard. It was a big adjustment, but it's getting easier now. I really do feel like food is just for fuel. Most of the time I don't crave a lot of stuff, and I'm just happy to eat a little bit, and when I'm full, I'm good. So my blood pressure was borderline high. They were talking about having to watch it and maybe put me on medication before. It's completely normal. Very good right now. My resting heart rate is down. It's good. So health-wise, I'm doing a lot better too. That almost instantly corrected, like a month after surgery. That stuff just was a lot better. After I lost like the first 25 pounds, it was just a lot better. So I can see the health benefits. It's easier to walk. It's easier to sleep. So yeah, things are going really well, and I'm very happy that I did the surgery. In the first 2 months I wasn't so sure, but now I'm pretty happy that I did it. So that is my update. Oh, vitamins. I want to talk about vitamins. I found Bariatric Advantage has a solo vitamin, which is just 1 a day instead of 2 or 3. and I take that right before bed, and that has been a godsend because the other, I just couldn't get the vitamins in, and especially when I was feeling sick at night. So this is perfect. I take it before bed, and then I just take the calcium chews during the day, but that's going better too. So I'm happy I found a vitamin that I could take. So that's my update.